Is your child's constipation more than just diet? Hi parents, I'm Dr. Shivani Deswal. I'm a pediatric gastroenterologist in Gurgaon, Delhi, NCR. I often get patients who are being treated for constipation for years. Their pediatrician has tried everything in the diet. The mothers have worked hard and given adequate water, adequate fiber to the child, and yet the child continues to pass hard, painful stools. Every time the constipation is not related only to diet. Of course, diet is a very important part of constipation management, but if your child constipation is not getting better despite adequate treatment for 3 to 6 months, by adequate treatment I mean by a proper disimpaction dose followed by maintenance dose, and you're not able to taper down the laxatives, that means your child is having refractory constipation which needs an expert evaluation. Other causes beyond diet are varied, and you must be aware. The most important cause that we see in children these days is the holding behavior. In holding behavior, I mean that the child is fearful of passing a stool in the toilet and tends to hold the stool, which remains in his rectum and keeps getting harder. And when he passes, he again has a painful defecation and it becomes a vicious circle. There can be various reasons that the child is having a holding behavior. One of the common reasons is that the child has had a past experience of a very painful hard stool or sometimes even blood along with stools, which makes the child fearful. The other reasons can be the child is too preoccupied in his video games and screen time or his coloring and does not want to go to the toilet when he has an urge. The third possibility is sometimes a child is fearful of the school toilets and tries to avoid passing stool during the school, and in the morning his routine is so rushed up that he does not have a fixed time and he doesn't get enough time in the morning to sit in the toilet and pass stool. So it is very important for mothers not to just make their children sit in the toilet and look away, but to look how your child is passing stool. Just passing a small amount daily does not rule out constipation. Sometimes your child may be going to the toilet daily, but he is passing very small rabbit-like or stools which are cracked and hard daily. That is also constipation. If your child goes to the toilet, just spends a minute and comes out, that may be that he's having a holding behavior because of a painful stool and does not want to sit longer. The other way could be that the child is spending too much time in the toilet because he has to strain and push too hard. A child who doesn't get the urge to pass stool is also worrying. If a child comes out of the toilet and complains of pain abdomen or complains that he doesn't feel that he's evacuated completely is also constipation. So a visual chart, which we call a Bristol stool chart, shown to a child or maintained by the mother can help us determine what kind of stool your child is passing. There are other medical causes also of constipation which need evaluation at times based on the history. So child may be suffering from celiac, which is very common in North India. Around 1 in 100 can have celiac. They don't always manifest with loose motions. Sometimes poor growth, abdominal distension and constipation are predominant features. Hypothyroidism or cow milk protein allergy in babies can also sometimes lead to constipation. Sometimes there is a congenital problem by birth where the nerves are not formed of the intestinal tract, which we call Hirschsprung's disease, in which sometimes we get a history that the baby did not pass the first stool, that is the meconium, within 48 to 72 hours. And also the baby has constipation since early infancy. Similarly, sometimes spinal issues or nerve issues or muscle issues can lead to constipation. These children usually have weakness of the lower limbs or they also have urinary bladder issues. So it is very important that whenever your child has constipation which is not responding to treatment in 3 to 6 months, you must consult an expert pediatric gastroenterologist and get this problem sorted. You must consult a pediatric gastroenterologist and get this problem addressed.